Hey everybody, it's Dr. Dave Psychiatry. Thanks for coming to the YouTube channel today. A couple of days ago, a gal said to me, my husband says you're really nothing more than a drug dealer. So this is sort of a fun video for me to make because honestly, I'm not a drug dealer. And it gives me a chance to talk about some of the basic aspects of why that's sort of a funny but interesting statement. The truth is, I'm here to help you with your brain chemistry problems. Hopefully anybody else who writes prescriptions for you, if you're not seeing me, that's what they're there for. And in fact, that's what we do is we provide medication. Now, what is the background for that? There's undergraduate school, at least 4 years. There's pre-med stuff, which is included in that or added additional to it. Then medical school, which is at least 4 years, and then residency, which is another 3 to 4 years, depending on what you do. So we're looking at between 10 to 14 years of specialty training just to be able to sit in this chair, just to be able to do stuff. Now, nurse practitioners, they don't go to school quite as long as a board-certified psychiatrist do, and they can write prescriptions. So there's a range there. But obviously, we have to have training. We have to be screened. We have to apply, get in, pass all the tests, etc., receive state licenses. So that's all the background stuff about how we're really not just drug dealers. We're actually professionals, and hopefully you're dealing with professionals. So first statement to the patient's husband is, hey, did you forget all that extra training and screening I had to do to become a responsible licensed professional to get here and do this stuff? I think part of the implication is that, hey, when it's going well, you go in, you see Dr. Holmes, it doesn't take that long, you're not really suffering that much. It's not like you have a cold suddenly and you have to go back in 2 or 3 months to get your medicines. Well, rules are rules. And depending on the state that you're in, we have rules about how long you can get medications for. And there's also what's called the standard of care, which is actually not a rule. The standard of care is what basically we're supposed to adhere to, is what are all your professional colleagues do around you. So for certain medicines, I really have to see you every 2 months. I do. And for other medicines, I have to see every 3 months. I do. That's not made up. That's just sort of how it is. That's called the standard of care. And my state licensing government cares about that. So if I get away from the standard of care, then I can expose myself to liability and have a problem. Nobody really wants to do that as a professional. We want to do things that are right. They're expected of us. So it's really required that you come to see me every 2 or 3 months, whether or not you want to, in order to get a prescription from me, which is a legally binding thing. I write a prescription and it's supposed to give you authority to get those medicines. That's what you have to do, so you have to come back. Now, when it's in follow-up, it's easy. When you're first getting started with me, it's not easy. And the first visits that we have are when people have gone from fine to not fine. You might have seen videos about that, why that happens, when that happens, what do we do. When you're fine, it's pretty easy. You go say hi to Dr. Holmes. He does all his background checks. He does his charting and stuff, and make sure that everything's legal and proper and you haven't any problems or side effects or there's no concerns. We do all that stuff in that, quote, easy visit. And if there's problems, we deal with that too. So obviously what I'm happy about is the patient that's talking about her husband. He's just like, why do you have to go see that guy? Can't he just phone it in? Well, no, I can't just phone it in. So one of the things I sometimes tell people that it's similar to is if you've ever had the opportunity to travel outside the United States, when you come back to the United States, whether it's from Canada or Mexico or Europe or the Caribbean or Asia, wherever you've been, if you have to come back inside the United States, if you've done this before, you know what I'm talking about. If you haven't done it before, you have to get in line and go to this Customs and Border Patrol security. Now, typically, it's where you walk through, where you're coming back into your port of entry, whether it's from a ship, from an airplane, or on foot, actually. You have to go to a place and see somebody. And that somebody is a Customs and Border Patrol agent. And typically, my understanding, not being one, but as the customer in this situation, it's a person in sort of a glass booth. And after you wait in line, whatever amount of time it takes, you go there and they ask you questions. So the question might be, where did you go? How long have you been gone? What did you do? Where did you stay? They could ask you 1, 2, 3 questions. They could ask you 10, 20, 30 questions. They can ask you to go to an interview room and they can do whatever they want with you. Ask as many questions as they want. Obviously, they look at your passport. That's in their computer data bank. So they can screen for what they screen for. They can do all the back stuff that we don't see as customers to try to decide if you're a valid person coming in or if you're a troublemaker or it's against the law or you're doing something illegally. That's what they're looking for. So the bottom line is, if you talk to the Customs and Border Patrol person for 60 seconds and they say fine, which it could be, hello, where'd you go? How long did you stay for? Anything to declare? Tell them the answers. Blah, blah, blah. Okay, great. Free to go. Thanks a lot. Look at your passport, scan it, whatever, and you're gone. I mean, I've done this in 60 seconds sometimes. Other times it takes longer. The point is, if you don't answer their questions, if you don't do the stuff that they ask you to do, well, you're not coming in the country. It's not going to happen. So the analogy there is that with me, unless you show up, unless you sit in that chair across the desk from me, unless you answer my questions, and if I have any concerns, if you can't answer my concerns, you're getting nothing. So you can say it's simple and it's easy and it shouldn't take that long, and sometimes it doesn't take that long. Some people are just, they're in a hurry or something, and it could be pretty brief. But the point is that when we do our professional thing, we do our professional thing. And we hope it's easy. We hope it's not hard. But unless you let us do our professional thing, you are not getting your medication. Now, does that make me a drug dealer? Obviously, the guy's not saying I'm a drug dealer. He understands this. But do we make it look easy sometimes? Sure. Does that mean that we're dealing drugs? No, we're not, quote, dealing drugs. We're doing our professional job that we have to do to provide you with the medication that you need for whether it's your serotonin that needs boosted, your norepinephrine that needs boosted, your dopamine that needs pushed down, your GABA that needs pushed up. If we're giving you medicines that do that stuff, it's got to come from a professional, someone who's licensed to write prescriptions, and that is a person like me. If you're not my patient, I hope you have somebody like you, like me, that's helping you. If you're looking for a doctor to help you because you have problems with anxiety, depression, attention deficit disorder, excess worry, insomnia, those things, I hope that you're able to find somebody. If you're not able to find somebody and you have a primary care person who's willing to help you, man, show them these videos. Get them to the YouTube channel. I've already had professionals tell me that they've learned stuff from this that made them more comfortable prescribing medication. I've already had patients say that my primary care doctor would not give me blank until he watched this video. I showed him this video, and now he's giving me blank. So that's fantastic. And I'm glad that these series of videos have some impact, not just for the patients, but for the professionals. So am I a drug dealer? No. Am I more like a Customs and Border Patrol person that you can't get your medicine if you don't see me in the kiosk? I'm more like that guy. I hope this is helpful. I'm had fun doing this video today, and I hope that you that the fella who triggered this video, the husband of the wife patient who's doing well, very happily so, and I'm happy for her, hope that you get to see this today. All right? I'm Dr. Dave Psychiatry. Thanks for coming to see me.